So today's talk is about skin tags. First of all, what is a skin tag? It's a pedunculated little polyp or mole on the neck, chest, armpit or elsewhere on the body. By pedunculated, I mean it's like a little lump on a stalk. It's a bit like a grape hanging from somewhere. People say, well, can I not remove this at home? We would say, no, don't do that. Historically, people have said,
well, I just tie a piece of thread around it and it drops off.
That may be true, but A, it's painful, B, it can cause infection, and C, it will leave a piece of the stalk. So cosmetically, you still have a little bit of floppy skin left behind. So my name is Dr. Mike T. I'm an aesthetic consultant in Harley Street Skin Clinic. My background is general practice, general medicine, ENT surgery, and 25 years of experience in all aspects of aesthetic medicine. I trained at St Andrews University and Cambridge University and have additional training in all forms of aesthetic medicine, ENT surgery, and if necessary, I can also deliver your baby. When we do this procedure in the clinic, first of all, we assess the tag to make sure it has no features that could be suspicious of a cancerous lesion. And then when we remove the tag, we make sure we remove it flush with the skin to leave a very nice cosmetic result. So who gets skin tags? Actually, everybody. Certain groups of people are more likely to get them if you are overweight, you have areas that rub, such as arms, thighs. Pregnancy can cause skin tags. Diabetes can cause skin tags. Overall, they're very common. Usually, they are benign, but they are cosmetically not very nice, and they catch. They catch on clothes, they catch in jewelry, and they are sore if they are rubbed between your arm and your chest or your inner thigh. So they don't have to be removed, but it's nice to remove them, get rid of them for a good cosmetic result and to remove any potential injury to them from jewelry, etc. So there are various ways skin tags can be removed. There's what I call the NHS way, which is where they can be frozen with liquid nitrogen. The problem with that is it's not very precise and you're left with quite a large pinky red scar. So it's not a technique we would use in our clinic. Multiple skin tags can be removed very quickly and very easily just with a very sharp scalpel. It is so quick and so easy, no anesthetic is necessary. It literally takes milliseconds to get rid of them. For the bigger skin tags, we would inject a little bit of local anesthetic to make the skin go numb, and then we would remove them with radiotherapy. That effectively burns off the tag at the base and cauterizes the base to stop any bleeding. It's a very quick but efficient way to treat them. There are various kits that can be bought online for do-it-yourself or home removal of skin tags. They are cheap and cheerful, but I would urge caution. First of all, you're making an assumption that the skin tag is a non-cancerous lesion. And to be honest, 99% of the time you will be correct. But there could be the odd occasion where it actually is cancerous, and that should be assessed by a medical professional. A lot of the things that are available, such as vinegar, various acids, do-it-yourself cryo pens, can cause skin burn and scarring. It's a risk which is avoided by coming to see us and having it removed professionally. Threads and strings that you buy will remove a skin tag, but they can be quite painful to apply and they usually leave tissue behind, so cosmetically it doesn't look very nice. We make sure that doesn't happen and give you the best cosmetic result. So the aftercare for skin tag removal really depends on the size of the skin tag that's removed. If it's very small with a very narrow base, then hardly any aftercare is needed. And to be honest, an over-the-counter cream such as Savlon, which is soothing and antiseptic, is all that you need for a couple of days. We in the clinic apply an antibiotic cream for a couple of days to prevent any infection, reduce inflammation, and help the healing process very quickly. Bigger lesions with broader bases are more likely to need these creams than very small, tiny lesions. People always ask me, what is the difference between a skin tag and a mole? Well, a skin tag is a narrow stalk-like lesion. It's a bit like a grape hanging from a piece of skin, whereas a mole is a broad-based, flat lesion, and that has to be removed much more precisely. It has to be burnt away layer by layer and is a more difficult, technically more complicated procedure. It's still relatively simple for us because we do it all the time, but it is not something you should try and do at home. So I'm always asked, will a skin tag grow back? Well, the one we remove will not grow back, but if somebody is overweight and the skin tags have been caused by friction, skin areas rubbing together, then you are likely to get more new tags. But again, they can all be removed. Removal of skin tag is not really a painful procedure. There's a little bit of discomfort, but it's minimal and momentary, that's all. Generally speaking, because of the size of the skin tag, in other words, they are generally really very small, scarring is not a problem. So in summary, skin tags are common. We see them all the time. Anybody can get them. Many people do get them. Can they be removed easily? Yes, we can remove them in one of several ways, which is minimally uncomfortable, will not create infection, will not give scarring, and should not produce any complications further down the line. The ones we remove will not come back, but of course you're always at risk of getting new ones in the future. We would advise any mole or lesion that is irregular in size, shape, colour, or is bleeding, itching, or enlarging should be looked at by a professional. So if you have one of these lesions, please do not hesitate to book an appointment, come and see me, get a professional opinion, and get the lesion dealt with.